Currently, we have 1,006 tests that are pending. For those of you who are awaiting test results for COVID-19, please check the Ministry of Health's online portal or the link on our website. Please remember that you must remain in self-isolation while you are awaiting your results. I will now share the most current case counts. There are 81,313 confirmed cases of COVID-19 in Canada and 24,187 cases in Ontario. Chatham-Kent has 142 cases, and Sarnia-Lambton has reported 243 cases. Michigan now has 53,510 cases, with 10,558 cases being in Detroit. Today, we are reporting 843 cases of COVID-19 in our community, an increase of 17 cases from yesterday. 8 new cases are workers in migrant farms, and 9 cases are in the community. 35% of our cases have occurred in long-term care and retirement homes, both among residents and staff. 473 cases have resolved. 19 people are in hospital. 17% of our cases are between the ages of 20 and 29 years. 16% are between the ages of 30 and 39, and 18% of our cases are 80 years and older. 44% of our cases are male, and 55% are female, with 1% unknown at this time. Our community has lost a total of 63 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. 5 additional long-term care and retirement homes have come out of outbreak. Our health unit is currently working with 8 long-term care and retirement homes that are currently experiencing a COVID-19 outbreak. Testing for COVID-19 is based on a clinical assessment. Testing should be considered even if you have 1 symptom. Common symptoms include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. Please note that SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please note that testing is now available for people who even have 1 symptom of COVID-19. I just want to remind you that we will resume our Facebook Live sessions on Monday. Also, this weekend, we will not be issuing any media releases on Saturday or Sunday, but please continue to visit our website at wechu.org for the most current information and updated case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone, and thank you for joining us again. This week, we noticed more businesses opening up, more people outdoors, and a general increase of overall traffic. Since the beginning of this COVID-19 pandemic, the staff at Windsor Essex County Health Unit worked tirelessly to protect and promote the health and well-being of our community. Public health has been the front and center of COVID-19 response, not only in our community, also in the province and in the country as well. The decisions and recommendations made by public health always considered the safety and well-being of everyone. The focus of each and every recommendation was to ensure that the recommendation is made in the best interest of the community and would not lead to any unintended consequences. Since the beginning, we noticed that individuals reacted differently to the closures and restrictions to protect from COVID-19. A significant majority followed the recommendations and are still looking for credible information in making every decision. But there are people who do not believe in these recommendations and feel that it is exaggerated. There's also a small number of people who feel that it's all a big conspiracy. This clearly shows that the human behavior is unpredictable, but it can change. For example, people following physical distancing, hand washing, maintaining respiratory etiquette, staying home. But if there is confusion in the messaging, it could lead to behaviors that can put individuals at risk. I therefore request you to please follow credible information and avoid any misinformation. With the reopening of economy under Stage 1, more and more businesses are opening up, and as we promised, that public health will be keeping a close eye on how it's impacting the community. To have a better understanding of these impacts, public health in collaboration with primary care providers and Essex Windsor EMS will be expanding COVID-19 testing in the community. Since the beginning of the pandemic, we had 6 healthcare providers spread across the county offering COVID-19 testing for their own patient, and some of these healthcare providers are doing testing based on public health recommendations. We will be looking at ways to increase the number of these healthcare providers in the community. Ideally, I want every healthcare provider in the community able to test their clients for COVID-19. More details of this plan will be worked out with Essex County Medical Society and the healthcare providers in the community to ramp up the testing in the community and give more options for people to get tested. We recognize that some people do not want to go to the assessment center and would rather prefer to get tested at their primary care provider office. I'm requesting all the primary care providers to offer COVID-19 testing to their clients. We will be working with all of the healthcare providers to support them in offering testing. In addition, thanks to our great partnership with Essex Windsor EMS, we will be offering random testing for COVID-19 across Windsor and Essex County. We will be offering a combination of a drive-through testing and a trailer-based testing at different locations across Windsor and Essex. To make it truly random and have a true sense of community spread, the plan is to pick a spot in the community where we can find many people outdoors and offer spot testing after collecting baseline information. You do not have to have any symptoms to get tested in that random testing, but you need to have your health card and other form of identification to ensure that we can reach out to you in case you are a positive. Please stay tuned for more details. We expect to start these random testing across the Windsor and Essex County starting next week. The information that we will collect with this true random testing will be valuable to assess the true community spread. A big shout out to our Essex Windsor EMS partners for their continued support in conducting mass testing in our community. We will now move on to our weekly epidemiological summary. Very quickly, this is what we will cover in our presentation. I'll focus on the key points to answer some of the questions that we ask every day. The epidemic curve or epi-curve help us assess the progression of the disease, whether in the community or in an outbreak situation. This particular epi-curve is created to show the number of confirmed cases by symptom onset date. On your vertical axis, you have number of confirmed COVID cases, and on the horizontal axis, you have the dates. The significance of using symptom onset date instead of the case reported date is to get a sense of when the disease transmission or exposure happened. This includes all cases, that is the community, as well as the long-term care homes, long-term care home and retirement home. Please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely accurate and subject to change. As we know, day-to-day variation can vary significantly, and we know COVID-19 do not cause disease right after the exposure. It could take up to 14 days to show symptoms. In order to minimize the impact of day-to-day variation, another way to look at the epi-curve is to present a 3-day moving average. 3-day moving average should capture day-to-day variation and will try to present a much better picture of when the community transmission is happening. We can see that roughly since second or third week of April, the number of confirmed cases is going down and moving in the right direction. In early weeks, we noticed a further decline in the number of cases. But please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely accurate and subject to change. We already know that yesterday and today, the number of cases have increased, and we need to be very careful on how the number of cases would look like in the coming days. We also know that we have a lot of our cases in long-term care home and retirement home. This particular epi curve was created to show the symptom onset date in the community as well as in the long-term care home. Earlier in April, we saw a shift of positive cases from community to long-term care home and retirement home. This was the same time that a number of measures were implemented at the long-term care home and retirement home to ensure the safety of the residents, such as universal masking policy, restricting healthcare workers to work only in one facility, extra support from acute care hospital partners, mass testing, etc. Now that all of these measures are in place, we are seeing a decline in the long-term care home and retirement home cases. We are seeing more cases now in migrant farm population now. So another way to show this same epi curve is by the line, where you can see the community cases and the cases in the long-term care home and retirement home. The next logical question comes to our mind is, are we seeing something really bad? How are we comparing ourselves with the other regions and the province? Windsor, Essex has the 4th highest rate in the province, and our rates are higher than the province, higher than the provincial average. We have experienced a higher proportion of cases in long-term care home and retirement home, including staff and residents, compared to some of our neighbor communities such as Chatham-Kent, Sarnia-Lambton, and London. Windsor, Essex had 36% of our cases from long-term care home and retirement home, with a peak at 42%. Sarnia-Lambton had 35% of their cases in the long-term care home. Chatham-Kent had no cases in their long-term care home, and London had 33% of their cases in the long-term care home. We look at the regional and provincial rates per 100,000 population to make a comparison. We use the statistics to compare the number of cases based on the population size. Please note that this comparison does not account for variation in number of people in different age groups. For example, roughly 18% of our community members are seniors, that is age 65 plus and older. This is in comparison with the provincial average of 16% seniors in the province. Sarnia-Lambton also make up roughly about 21 to 22% of their senior population. The next question is, how about the testing? How are we performing these testing, and what the percent positivity look like? We started to see a decrease in testing compared to the mass testing that was conducted in previous weeks in long-term care home and retirement homes and other congregate settings. There have also been a decrease in testing across the province, which has increased the percent positivity from 2% to approximately 4%, with at 1.7% positivity earlier this week. We experienced that too, where on May 19th, 4% of the tests we completed were positive, and on May 18th, this was a 15% positivity, but we only conducted 103 tests on that day. Another question that is frequently asked is about asymptomatic people coming back positive for COVID-19. We did some proactive testing in all the long-term care homes and retirement homes and tested more than 4,000 residents and 2,300 staff in these facilities. The analysis is of percent positivity among symptomatic and asymptomatic individuals in these facilities. As you can see, there's a significant variation between asymptomatic staff, symptomatic staff, asymptomatic resident, and asymptomatic residents. Based on our analysis, we can say that roughly 0.8% of the residents within a long-term care home or retirement home are without any symptoms and can still be positive for COVID-19. 0.4% of all the staff that were part of the mass testing were positive and asymptomatic. Please note that we cannot rule out false positive in these asymptomatic cases in both residents and staff. The low positivity in staff highlights the importance of active screening and daily monitoring, including temperature checks, for early identification of cases and keeping them away from work. Next up is the age and gender distribution. The purpose of creating this graph is to show if there's a gender difference in getting infected. Based on the analysis, it appears that among male, COVID-19 cases are highest in the 20 to 39 age group, and it decreases as the age increases. Among female, the distribution is pretty much even between the ages of 20 to 59, and the highest was among the age of 80 plus. We noted that there's a shift in age group with more positive cases, and our EPI team did a sub-analysis on the age distribution among the recent cases. Since May 1st, the new cases are significantly high between the ages of 20 to 39, and a good number of them are healthcare worker, and probably they had the higher chance of exposure to COVID-19 patients. But for anyone in that age group, I would like to remind them the importance of physical distancing, appropriate hand washing, and respiratory etiquette, and most importantly, staying home when they're sick. It is absolutely important for us not to lose our guard when things are actually starting to improve. Please follow the public health recommendations. This particular graph shows the distribution of COVID-19 cases by municipality. No surprises there. Almost 2/3 of the cases are in Windsor, and as more than half of the population live in the city of Windsor, and each of the municipalities have cases as well. 12% of our cases are from Leamington, but that's because we have seen an increase in cases among migrant farm workers. Significant differences in number of cases in some of the municipality is due to the high number of positive cases in the long-term care home and retirement home. Same caution, these distribution doesn't mean that the COVID cases exist more in one community versus the other. Everyone is at risk, and every community is at risk, and everyone needs to take precautions when they're outside. Through the extensive contact tracing the health unit is carrying out, we are able to identify the majority of the exposure as close contacts. This can include close contacts in a household, long-term care home, retirement home, congregate settings such as shelters and migrant farms, and this also shows the impact of our measures. If we can track down most of the cases to a close contacts, that means we are reducing the community transmission. If you look at the cases in the last few weeks, most of these new cases are happening in close contacts, which is represented by green shades in the bar graph. The yellow cases represent the community transmission. Looking further into the COVID-19 by healthcare worker status, around 27% of the cases in our community are in healthcare worker, and of these 219 cases, or 27%, 55 of these healthcare workers traveled to Michigan. Around 6% of the cases visited a healthcare facility immediately before getting infected. This highlights the importance of following the infection prevention and control guidelines in all these settings. Another question that is frequently asked is if the cases had any underlying chronic health conditions. Almost 2/3 of our cases did not have any underlying medical conditions, and about 1/3 had some kind of underlying medical conditions. A quick look at the cases and what symptoms they are reporting. 71% of the cases presented with cough. This could be new or worsening cough, and last week this was 85%. The reason for the change is that we are starting to see our recent cases either being asymptomatic or reporting milder symptoms. This could be due to symptoms not displayed on the above figure. Please note that the cases can report more than one symptom, and that is why these numbers will not add up. This particular graph shows the number of hospitalization patients in the ICU on any given day. It can include both new patients as well as existing patients with COVID-19 in each of these settings. Cases in the ICU remains relatively low for the past couple of weeks at approximately 3 or so cases. Hospitalization have stabilized since late April, with fluctuation over the past month or so. So where are we with all these cases? A little more than half of these cases are now resolved or recovered. A little under a quarter of these cases are currently self-isolating. Unfortunately, we have lost 8% of our cases, same as the last week, to COVID-19. Less than 4% of these cases are currently in the hospital or ICU. And some of these cases that are currently self-isolating may have been admitted to the hospital initially, but discharged when they did not need any medical care. Please note that this does not include individuals who are at the field hospital. Looking at the age and sex breakdown of COVID-19 deaths in our community, overall, more females died with COVID-19 diagnosis compared to males. From an age distribution perspective, almost 3/4 of the death were in individuals who were 80 years and older. The youngest person died in our region was a man in his 40s. This particular graph shows what it means for individuals who contracts COVID-19. In our community, the overall case fatality rate is 7.6%. Those who are living in the long-term care home and retirement home, case fatality is significantly high, close to 16% in this particular age group. As of May 20th, the case fatality rate in all of Ontario is 8.2%, which is slightly higher to the Windsor, Essex. In the long-term care home and retirement home across Ontario, the case fatality rate is higher compared to the provincial rate. The number will vary depending on how the Ministry and Public Health Ontario provide their data. This is based on our assessment of the information that is available. The doubling time tells us how many days it will take to see twice as many COVID-19 cases in our region. It tells us how quickly COVID-19 is spreading in our region. This specific graph looks at our doubling rates since our first case was reported. Currently, we are past 5 days, considering in late March and early April, we were doubling every 2 days, and we're continuing to see the flattening of the curve in this particular graph. Another way to represent is doubling rate over day to day, and this allows us to compare our cases with the provincial average, provincial doubling time and the Canadian doubling time. Overall, as a country, a province, and locally in Windsor, Essex, we are heading in the right direction, but we need to continue to follow the public health recommendations or practice physical distancing while in public. The most recent estimated R0 is 1.07, which is higher than the last week when I presented this information. When the R0 is less than 1, each existing infection caused less than 1 new case. We are just above this number. With an R0 of more than 1, we will see each case existing infection will causing more than 1 new infection, and that means that the community will continue to see the spread of COVID-19. The shaded area demonstrates the variation that we see, but all this is based on certain assumptions. The assumptions are the first case is imported, as in brought into Windsor, Essex. The rest of the cases are identified as locally acquired, and the most accurate date used is the symptom onset date. So in summary, case counts locally continues to show an overall declining trend with day-to-day fluctuations. Windsor, Essex has the 4th highest rate of COVID-19 cases in the province. 56% of overall COVID-19 cases have resolved. Overall case fatality rate is slightly lower in Windsor and Essex compared to the province of Ontario. Doubling time of cases is generally similar to the province and the country. And the current R0 effective is slightly greater than 1, signaling community spread is still occurring. Thank you.
We'll now take questions from the media.
We'll start with Windsorite.
You mentioned Windsor, Essex has the 4th highest rate in the province. Is that growth rate, or is that we have the largest amount of cases by health unit?
So it is based on per 100,000 population, and we use this measure to compare across different regions because every region may have different number of cases. We have our cases surpassed 800 mark, and if you're comparing it with a smaller community, we'll have to standardize it up to a certain number of populations. So all this data is based on 100,000 population standardized, and when we are comparing ourselves with the rest of the province, we are at the fourth highest rate in that sense.
Any questions from the Windsor Star?
Hi, can you give an idea of where and how you'll go about doing the random testing?
Well, we want to really make it truly random, and we would not be disclosing where we will be on that particular day. But the idea is we will identify a location in each of the municipalities to allow us to analyze all that information based on each of these areas. So any location will be identified where we are likely to see most people outdoors, and we will go to them. We will ask them for their consent to get tested, and if they allow us to if they give us the consent to test, we will test them. And the testing strategy could include either a drive-through type setting or a trailer setup where these testing will happen. Again, it all depends on the location and on the specific day.
Any questions from CBC?
Yes, good morning. Why the decision to go with the random testing?
Well, I explained that in the beginning of my talk. Is we like to see what impacts all these openings are having in the community, and now when more and more people are outside, the likelihood of them coming in contact with other people will be high. And in order to truly assess whether if someone has a symptom or no symptoms and they're still outside, and what does it look like? What is the risk to the community in those particular areas? And if the end of the result, if we see more positive cases based on these random testing, that means that we still have cases circulating in the community, and maybe we need to revisit that how all these openings and how the impacts are happening in the community. So all this will give us valuable information to help us make evidence-based decision, and we would be looking to do it in each of the municipalities to have a better sense of every municipalities in the region.
I was out yesterday, and I want to say maybe 20% of people were wearing masks. In Michigan, it's required before you go into a building. Will there be a push to make people wear masks before they can go inside?
At this point, there is no push, and as we know that it's a lot of that is on individual responsibility and even how they're using the mask. I can force someone to wear a mask, but I cannot force them to ensure that they're wearing it correctly and they're wearing it all the time. So I think we need to take that responsibility on our own and to ensure that we are doing our due diligence and wearing the mask in settings where physical distancing may not be possible.
There was a lot of information at once. Can you just go over, is it healthcare workers, employees that you want to all have tested, and you're providing that testing to them?
With the random testing, it's the general population that we are planning. We have further plans to expand it to some of the other employee settings and workplaces, but that would come in a later phase.
Okay. Why the decision to not provide any updates on the weekend? Is it because the cases are slowing down?
The cases are being consistent, and I think in terms of the uptake as well, that we feel that some of our staff are providing that update regularly and have been working over the weekend as well. And I think we will be updating the numbers on our website every day, so that information would be there. But to having a media release going out, it takes many people engagement, and we are trying to be mindful of everyone and the need for information. If anything significant come up over the weekend, I'm on call. Our team is always on call. Our staff will be at the health unit doing all the follow-up case and contact management. So we have staff there, but not necessarily the media people here to provide that kind of update. If something significant come up, we will be reaching out to the media and do a release as needed.
Okay, thank you.
Any questions from Blackburn?
Yeah, just in terms of the random testing, I know you said it's kind of to make evidence-based decisions, but if we're not getting the test results back in a timely manner, will it be effective for case and contact management to do these random tests? I mean, will these people be required to self-isolate after they are tested?
Well, the hope is if someone who is asymptomatic, if they don't have any symptoms, there won't be any recommendation to self-isolate immediately based on these random testing. If someone with a symptom shows up at these test sites, and based on the symptoms, we will be asking them to self-isolate until we get the results back. For someone in these type of setting, having a test done without any symptoms doesn't put them at a risk of spreading it to others. And then our recommendation, as always, would be if you develop symptoms, you need to self-isolate and you need to stay home. With working with the lab, the expectation is we will get those results back quickly. And we have seen some improvement, but again, that's yet to be seen. We are really hoping that we can get a quick turnaround time for these tests, not only just for these tests, but all the tests in our community.
And what's the current turnaround time?
Again, it varies. We are getting some of the results back in 1 to 2 days, and some are taking longer, and that's not something that we can control. But we are in constant communication with the lab to get those results in a timely manner.
Any questions from CTV?
I'm just curious. You probably said it, but I missed it. But when will this random testing begin?
We are finalizing some of those details, working with Essex Windsor EMS, and the hope is sooner than later, sometime around next week, that we will start those testing.
Okay. Just curious too. As more businesses begin to open, there's a push to support local businesses to keep them afloat. But there's also a desire for people to stay fit. I know a fitness place or facility that's ready to open. They have the system laid out for social distancing, and it looks pretty cool. So my question to you is, if a business is ready to open, do they need to wait for the next phase to open up, or can they get the blessing of the health unit to open up because they've taken into consideration all of the social measures?
So some of these recommendations are coming directly from the province, and we'll have to wait for the province to ease off some of those restrictions. I anticipate that some of these decisions may be pushed to the local health unit to do a risk assessment on some of these facilities, or providing some of those clear guidance. So we haven't received any of those details yet, but the expectation is we will be getting more details, and especially the businesses that have the ability to enforce or allow physical distancing. I can anticipate that they would be targeted in the next phase for opening.
I was going to say, I'm just thinking exceptions to the rules, because there's always an exception to the rule, but it's about allowing it, right?
Yeah. And if the province has said something not to open, I cannot override it, right. But it can be the opposite way, that if the province is allowing things to open, and if we feel locally that there is a risk, then we can take local actions, but I cannot undo the action of what the province is saying.
Fair enough.
Any questions from AM 800?
Yes, I do. With the random testing, how many more people are you hoping to test with that?
We have asked our epidemiology team to give us an estimate of a population estimate, a sample size that would give us a representative sample for each of the municipalities. The hope is when we have a representative sample for each of the municipalities and doing it truly random, we will have a better understand of the spread in each of the municipalities. So I don't have a specific number, but the testing will probably go on for at least 2 weeks, and we are expecting that anything between 1,000 to 1,500 people will be tested based on those sample size. And again, those are all estimates. We don't know how many people we will see in each of these days or location, and that is yet to be seen. But we would like to have a representative sample, and our EPIs are working us to provide with those sample size for each of the municipalities. And once we have all those details, we will be using that evidence-based approach to ensure that the sample size is representative of the population.
Okay, so between 1,000 and 1,500 over the next 2 weeks.
That's the expectation. It could high, it could be low, but right now that's the number that I can think of in my mind. That's based on our daily capacity. We in settings which is very prescribed, the testing can happen very quickly. But in a setting like this, in an outdoor place, or using a drive-through test model or a trailer-based testing model, we don't know the exact capacity of each day, and also we don't know how many people will consent and get tested each day. But at least at the minimum, that's the number that I am looking for. But again, if the sample size calculation shows we need more testing, then we can expand it. We want to make sure that we are getting that representative number to give us more information for our community.
I have to ask this question because I'm sure people will ask it as well. Does getting the test hurt? And I only ask that because I see that swab going way back.
Well, again, depends. Some people, if you ask them if you're getting an injection shot, does it hurt? Some people will say, no, it doesn't. And others will say, they will just scream that it hurts a lot. For most people, I would say they do fine. They do not scream or they do not overreact. But the exceptions are always there. So it's hard for me to say that it actually hurts or not.
Okay. You said 2 pieces of ID, a health card plus something else, or is just the health card okay?
Well, we like to record the address, the contact information, and the health card will really help people to go online and see their results online. Recognizing that as more and more testing will happen, it would be very difficult for the health unit to reach out to all the negative cases. So when people provide these type of information, they can go online and then they can check their status. For anyone who come back as a positive, so we will definitely follow up with all of the positive cases to ensure that appropriate case and contact management is happening. But it's just in their best interest. If they have a health card, they can go online and find that information, and it will be much more easier and convenient for them.
So if they don't have a health card and they consent to the test, will the test still be administered?
We do not want to turn anyone away, but as I said, it would be much more easier if you have a health card handy. Most people carry their health card. I carry my health card all the time. If they do, it's just easier for us to track them, and it's easier for them to ensure that they are getting their online results. But we do not want to turn anyone away just because they do not have the the health card. But I would request that people present their health card for testing and follow-up.
The health card is mandatory for this.
I don't want it mandatory. It's I would say that please bring health card for us to follow up.
Okay. And how many times will you be doing, will it be like once a day in Windsor on a Monday, and then on a Wednesday you're going out to the county? How many times per week? Or
the expectation is it would be daily, and again, the location, which locations, how many locations, those are the details that we are still working out, and we'll share some of that detail after figuring it out, all those the minutiae of the plan.
Okay, I think that's it for me. Sorry for all the questions, just people were asking me to ask, so.
Any further questions from Windsorite?
Yeah, just one question. For the random testing, you said that people do not require symptoms to be tested. Are there any plans to open up testing to asymptomatic people at the assessment centers?
Well, I guess, again, we'll have to take a phased-in approach. We recognize that some of these decisions could come from the province too. At this stage, locally, from my perspective, this is where I am. I want to get a sense, but the expectation is as we'll collect more and more data, I think we'll have more evidence to support if we need more asymptomatic testing or people for anyone who is coming to test. The biggest reason is we need to have a range of test options. So either we need to have like a point of care testing. For anyone who is asymptomatic, I think the best test to do that is the point of care testing to know your status right then and there. There are a lot of tests that are currently being validated for point of care testing. So I'm hoping that that should come out soon. And then also we need the serological testing or antibody testing to have a sense of who was previously infected. So when you have a range of these type of tests available, it makes it much more easier than how we are interpreting all these tests. The nasopharyngeal swab test, it is a diagnostic test, and it's not a screening test. And basically, we are stretching it a little bit more to use it in some way if we are talking about asymptomatic people testing using the nasopharyngeal swab. There is a caveat, and that's I want to make sure that everyone is aware of that. Testing people with nasopharyngeal swab does not prevent any COVID disease, or does not identify that if someone is at a high risk of contracting COVID or a low risk of contracting COVID. It's just a snapshot in time. The very next day or very next moment, you can get infected with COVID-19. So anyone even who is getting a test done while they're asymptomatic, and if it's negative, the hope is they should not change their behavior, or they should not think that they won't contract COVID or they are safe. That's the unintended consequence that I think everyone needs to be mindful of. If you are getting tested, that means it was just on that specific day. It's good that if your test results come back negative, it doesn't mean that you should lose your guard and then you should just start to take risky behavior, forget all the rules of physical distancing and avoiding other type of behavior such as hand washing or respiratory etiquette, etc.
Any further questions from the Windsor Star?
I'm good, thanks.
CBC?
I just had one about the primary care providers you spoke about earlier, about their testing. That's what I was asking about, having testing more employees. You were providing testing to them because you said people weren't feeling comfortable to go to the assessment center. Can you just go over that one more time, please?
So the primary care providers, that's another thing that we'll have to work out on the details. Right now, we have at least 6 primary care providers spread across the county and the city, who are doing their testing of their own clients. The hope is we want to expand and reach out to other primary care providers, walk-in clinics, other places that are currently open and seeing clients. And what would it take for them to do that nasopharyngeal swab testing on site for their clients who are visiting those facilities? We recognize that there were some challenges, especially with the PPE and the ability for people to test these individuals. As we know that at least for the next coming months, or at least a year, COVID is not going anywhere, and it will continue to exist in our community. And we need to have all these options available for everyone, not only just to go to the assessment center. We only have 2 assessment centers. We want to make sure that we have other sites available for people to go. The best place most people prefer is to go to their family doctor, but the family doctors need to also have some things in place before they can go ahead and start those testing. So all those details, I think, would need to be worked out individually, and I have already reached out to Essex County Medical Society, and we will be working very closely with them, with all their membership, to ensure that they know what it means to do their testing and what they need to go on with the testing, including the availability of PPE and everything. So we want to work with them, and we want to support them in from a public health perspective. And we'll make a case, and that way we should be able to test more people out in the community, and not only just at the assessment centers.
Thank you.
Any further questions from Blackburn?
No, thank you.
CTV?
Yeah, when do you hope to have primary care, or sorry, not primary care, clinics and family doctors online for this testing?
That's something that I think we've started the conversation, recognizing that not many of them are open at this point. So I would anticipate it may take at least a couple of weeks to get it up and running.
Any further questions from AM 800?
No, I'm good, thank you.